This episode is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Visit progressive.com to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary, not available in all states or situations.
The Red Apple Media Podcast Network presents This is Protecting America. Now, here's Emmy-winning journalist Rita Cosby.
Welcome to another edition of Protecting America. I'm Rita Cosby. So many questions about President Biden's cognition and a report that a Parkinson's expert visited the White House 8 times in the last 8 months, including one meeting with President Biden's own physician. The White House, however, continues to be very vague and says that President Biden essentially does a cognitive test every day when he's performing the regular duties of the President of the United States. Well, joining us now to talk about this and so much more is Dr. Peter Michalos, a board-certified physician, and he's also our WABC resident genius. He is a regular on the Katz and Cosby Show. Dr. Michalos, great to have you here.
Always great to talk to you, Rita.
What do you think is going on with President Biden from a cognitive standpoint?
Well, first of all, I have to say, I obviously have never examined the president. We can only go by what we see on television and observations. And, one of the things that you look at, for example, people keep talking about Parkinson's, but some of the classic symptoms of Parkinson's, for example, are having a tremor. And I have seen no evidence of him having any type of tremor. And the other thing is that people with Parkinson's have difficulty smiling, and he actually does smile. The other thing you see with Parkinson's patients is they tend to use a monotone voice, which he doesn't. They tend to speak very, very quietly, which at times he really doesn't. The other symptom of Parkinson's is something called rigidity, and basically you'd have to see the results of a physical exam to be able to talk about that. And, you have to also go back for someone who has been through, he was 45 years old when he had, 2 surgeries that ran 4.5 hours each to clip a brain aneurysm. And people who've had their brains exposed to the air and having that type of trauma, he's done remarkably well since that time to ascend in the various levels of government. But having had that prior brain trauma does affect things quite a bit. But the thing that people don't really talk about is one of the things that he has that doubles actually increases your risk of stroke more than 5 times is having atrial fibrillation. And that's public information. And it's out there that he has AFib, and yes, he's being treated for it. And when you have atrial fibrillation, that's a quivering of the heart, your risk of heart attack and dementia is 2-fold more than the rest of the population. And some of the things that aggravate AFib are stress. And I think being president of the United States is an extremely stressful job and emotionally draining in many ways. And that can also be aggravating his atrial fibrillation. So one of the things that most doctors would ask for is, can we please just see the MRI? Because the MRI will show the prior clips where it clips. An aneurysm is like a bubble on a blood vessel, like a bicycle tire bubble. And basically, before it bursts, you have to clip it off. His first one was actually bleeding. The fact that he even survived that is a miracle. So you would probably see that on the MRI. You probably see some scar tissue. But the question is, with this diagnosis of atrial fibrillation, is he having, for example, something called mini strokes, called lacunar infarct? So I think it would be better for everyone if they were just transparent with the reports of the MRI and the imaging of what exactly is going on there, and just put it to rest. The other thing is that it's variable, because sometimes you can be feeling totally with it, or if you just if you're 80 years old and you're doing transatlantic flights and changing time zones, we all have to admit it takes time to recover. I don't care who you are. It's not easy to recover for that. And the other thing that nobody really talks about is recently as a father, he has a son who he just got convicted with a felony and possibly faces jail time. And it doesn't matter who you are. If you're a father and has children, your stress level shoots up. And another thing that happens is the AFib gets aggravated by stress, and then the brain has an area in the brain called the amygdala, and that sort of takes over. And in stressful situations, and you have memory and cognitive issues, and there's a lot of things that I think that his doctors could just say, okay, these are the results we had. I was just having a long discussion with Dr. Magdalena Swarczewski, who's an internist and anti-aging specialist, and there are testing that they can publish. There's the Montreal Cognitive Test, the MoCA test. It's called the Mini-Cog test, and they're not that complicated to do, and they can just present these are the findings from that test. But he's got several reasons, but he doesn't really have the classic Parkinson's. And a lot of people who are high-profile people also get Botox on their foreheads, on their face. And sometimes when people see that mask face look, then you have like 0 wrinkles on the top of your head. It could also be that you're getting, you had some fresh Botox, and that can make your face have that mask appearance. But as I said before, he smiles. He doesn't have the tremors. He doesn't have the monotone voice. And so I think it's probably a combination of things, but there's going to be good days and bad days. But obviously, the debate brought out some issues, and then there was another issue that he possibly had a cold. And if somebody gives somebody who has, who's in their 80s and gives them cold medicine, guess what cold medicine does? It can make you sleepy, drowsy. It can affect your ability to concentrate, and there are medication side effects that can affect your cognition and focusing. Because, then the next day when he was speaking to someone else, he sounded very different. So it waxes and wanes. So I think we just need transparency from the physicians and to find out. And I just, I wish him well. And, hopefully he gets whatever treatment is necessary to get better and to feel better. And also, I think the thing with his son is really hurting him a lot more. And also, in many ways, I feel sorry for Hunter Biden, too. Imagine being a young boy sitting in the back seat of the car and you get broadsided and you watch your mother bleeding out and dying in front of you and your little sister. So he's like traumatized for life, too. And a lot of people like that who I've spoken to over the years, because I used to work in the prison system in Rikers Island, and I dealt with a lot of people who were in bad situations, and they had these common stories of a very traumatic event during their childhood that led them to, drug abuse and other issues and other problems. So I'm just trying to also look at both sides of the situation. And,
that's interesting, by the way. That's a very interesting point, because people who sort of go through trauma, you're right, kind of lead off to, and certainly the family, sadly, has had its share of it.
There's a human side to this story. And, sometimes we can all be, tough on the outside. And even what, President Trump is going through constantly, day and night, being attacked in every angle, it gets to you, and it's very hard. And then, you see a lot of the people and even your loved ones, they distance themselves from you, and it's very difficult. I had a friend who was a prominent ship owner once, and he said, I thought I had 100 friends, and I was going through my divorce. I only had 5 friends. And sometimes when someone's going through the legal system and they're in court every day, a lot of people don't want to be around and don't show up. And that's why, some people who did show up to be supportive, because, C.S. Lewis had a great quote about the importance of friendship. And one of the greatest advices he said to give is to have people who are supportive around you and having your friends around you. Because I think that both these men are going through a very, very difficult period. But we're going to see. I think it's all going to pan out in the next few weeks. And I think hopefully there'll be more transparency. But there's not, people say, oh, he's got Parkinson's, but when you look at it, just being objective. And again, I've always been independent in my life. As you know, I just do the medical stuff. I don't do politics. And I try to find the human side and have compassion. But if you just want to be scientific, again, it doesn't have all the classic signs that you would see in a Parkinson's patient. It's just simply not there. So I think that there are issues of having prior head trauma. I think having the AFib, as we talked about, having prior aneurysms, he had it on the left side of his brain. That's classic, that people who have scar tissue there tend to get memory issues and cognitive issues at an earlier phase in their lives. And, he's up there already. And I think, most people would say he's a medical miracle. Most people who have a bleeding aneurysm, and back then the technology of 1988, the fact that he's, done this well, this long is quite miraculous. So I think we have more to hear, more to find out. And, we wish everyone well, but obviously as a country and as an American, we're all concerned who's carrying the nuclear football. We want them to be healthy and strong, just like if a neurosurgeon or my pilot who's flying me on an airplane, I'd want to know that their mental health and that they're balanced and that they're able to concentrate and to think properly and make proper decisions, because we want people to make, proper decisions, not make rash decisions, because this not only affects one or two people, but who's ever the president of the United States affects the entire world.
Fellas, Degree Cool Rush deodorant, right? Well, last year they changed the formula, and guys were mad about it. One dude even started a petition. So guess what? Degree heard us, admitted they messed up, and brought the original Cool Rush scent back exactly how it was. And it's in Walmart, Target, and other stores now for under $4. So grab some and remember why its cool, crisp, and fresh scent made it the #1 men's antiperspirant for the last decade. Degree Cool Rush is back, and it smells like victory for all of us.
This episode is brought to you by LifeLock. Between two-factor authentication, strong passwords, and a VPN, you try to be in control of how your info is protected. But many other places also have it, and they might not be as careful. That's why LifeLock monitors hundreds of millions of data points a second for threats. If your identity is stolen, they'll fix it, guaranteed, or your money back. Save up to 40% your first year. Visit lifelock.com/podcast for 40% off. Terms apply.
Mic check. 1, 2. Are we recording? Hi, I'm Michelle Bernstein, an award-winning chef, restaurateur, and mom. I have a lot on my plate, including my psoriatic arthritis symptoms. That's why I was prescribed Cosentyx. It helps me move better.
Cosentyx secukinumab is prescribed for people 2 years of age and older with active psoriatic arthritis. Don't use if you're allergic to Cosentyx. Before starting, get checked for tuberculosis. An increased risk of infections and lowered ability to fight them may occur, like tuberculosis or other serious bacterial, fungal, or viral infections. Some were fatal. Tell your doctor if you have an infection or symptoms like fevers, sweats, chills, muscle aches, or cough, had a vaccine or plan to, or if inflammatory bowel disease symptoms develop or worsen. Serious allergic reactions and severe eczema-like skin reactions may occur. Learn more at 1-844-COSENTYX or Cosentyx.com.
Ask your rheumatologist about Cosentyx.
Ready to make a real impact every day? Join the Active Day Home Care team and help clients maintain their independence in the comfort of their own homes. Make a difference in someone's life as you provide essential daily assistance and protect their health and happiness. Earn up to $20 an hour and enjoy additional perks like optional daily pay, 401k, paid time off, ongoing educational training, and more. Join a team that values care, compassion, and your professional growth. Visit activeday.com to apply.
Absolutely. And that was where I was going to head, Dr. Peter Michalos, because if you are the president of the United States, it's undoubtedly one of the, or if not the toughest job in the world. And even somebody, I think about President Obama or others who came into the White House who, were young and in great physical health. They look like they aged 20 years by the time they got out, just because the nature of the job. You're juggling so many different things right now. There are wars. There's so many issues going on. How tough is that? How important is it also to have someone with great cognitive skills? I mean, it is key because there's so much at risk.
And it's also the people who surround you in your succession plan. That's why, if, for example, if I was President Trump, I would announce my entire cabinet up front and have a whole team of competent people lined up, and you run as a team, because it's really not one person.
Yeah, by the way, you know who suggested that? Was somebody we both love. John Catsimatidis suggested that. It's a brilliant idea.
Absolutely. Yes, that's very, very important, running as a team, and people know up front, this is my team and this is my backup system. Just like sometimes people go to an accounting firm and it's one accountant, and that accountant has a problem, and suddenly nobody has any type of, follow-up or succession plan. And that's another thing. People want to know that there are competent, experienced people who are ready to step in, who've actually done the job, or people who've actually ran a business or met a payroll, or had to provide people with health insurance and understand day-to-day, difficulties of life. So you want to feel that when you go to sleep at night, that there's a team and a succession plan that is there because of equal opportunity and not equal outcome. So that's very important, that, we feel as Americans that we have very competent people in each department, and that we pick people for each position. And, I want my pilot, I want my surgeon to be people who did very well in medical school, or did very well in pilot school, or who are, competent and who did pass certain basic, medical examinations. If you want to be a pilot, you have to go through all kinds of medical testing to get your screening. And quite frankly, I think that, people in government too should, have some type of basic, screening. I know my brother, who's a senior mechanic, he has to get drug tested all the time.
Do you think the President of the United States should be a requirement for somebody, maybe especially at that level, to have some sort of a cognitive test?
I think yes. I think what has to be done would be to have a baseline. If you're a pilot, you have to have these annual physicals, and if you're a president, you should have an annual physicals, and it should be an independent panel and non-political people from who are well-established and known clinicians who have no relationship or who are not donors or anything like that, just independent physicians, just to say, hey, here's the objective evidence, here's the scan, here are the tests, and everything looks good. I think that, it's important, especially someone who has access and power to, start wars and can affect millions of people's lives in an instant. So I think that is an important screen. And also, a lot of times people get, I've seen presidents in the past release their labs and stuff. They do like basic tests. And when I was talking to Dr. Magdalena, and people go for an integrative medical visit, they do 150 biomarkers. They look at people's hormones. Like, for example, if you're a man and your testosterone level is very low, you might have low energy or not, be doing as well. You might have brain fog if you have hormonal abnormalities, or you have, for example, a heavy metal issue, or you can have liver issues, or you can have even an infectious disease. I know people who didn't know they had Lyme's disease and couldn't concentrate and do their job until they got diagnosed and treated. And I know I've seen that. I remember diagnosing someone through their eye who had syphilis, and they couldn't do their job. And then they got just their antibiotic and took care of the disease, and it changed their lives overnight. So, I think it would be nice if they require an annual physical, get all the biomarkers and say, here's my EKG, here are my biomarkers, here's my scan of my brain, and here's the report from an independent, neurologist or a physician. And everybody, I think this whole thing would be put to rest very quickly.
Yeah, absolutely. Now, President Biden came out recently in his case and said to, I think it was to Democratic governors when he had a meeting, that he would like to work less, rest more, maybe should limit late activities. There were reports also out that he's saying, he wants to work 10 a.m. to 4 p.m., that those are the best hours, or that aides are trying to schedule things. Somebody's referring it to sort of the sundown syndrome. Explain what that is, just real briefly.
Well, basically what happens is there are certain hours during the daytime where you have your peak energy levels, your hormones are functioning at their peak, and then you have something called a circadian rhythm. And then what happens is the body basically starts going into rest and sleep mode. And the older we get, the reality is we need more rest because most of our healing happens during sleep. We now know that we have a system in our brain called the glymphatic system, that when you're sleeping, the cerebral spinal fluid goes around and cleans up dead and dying cells and helps regenerate you. That's why you feel so good after sleep. We're designed to do most of our repair during sleep. And that's why it's not good to eat late at night, because we now know that 80% of our immunity is in our gut, and a lot of our happy hormones for our brain, serotonin, is made in the gut. So when you don't have food in your gut late at night, your gut is focusing on repairing, healing, and recovering. And if you're somebody who's in their 80s and you've had these prior traumas, guess what? You go on an airplane flight, you go to a different time zone, and sundowning, you start experiencing restlessness, agitation, irritability, confusion, and it worsens as daylight begins to fade. And that's the actual definition of what sundowning is. But again, he doesn't have the classic of any of these things. That's why these pundits are talking about different things. But you have to look at what the objective evidence is. He's got a few things that can affect you. Advancing age, atrial fibrillation, which can throw up microclots at any time, prior head trauma, 2 aneurysm brain surgeries. And I think one of the biggest things affecting him right now recently is the severe stress he's under. And the stress as a father, just seeing what's happening with his son, I think it's really hurting him a lot. Anybody out there who has a child who, and I've been in emergency rooms and seeing when some kid has a DWI or the kid gets in that accident, dealing with the parents is the hard part because they're stressed out of their minds. They're the ones that are crying and screaming, and it's very, very difficult. And he's, holding it in, but he feels very bad. And, he lost his other son. He's the only son he has. So that recent situation cannot have been easy for him. And I think when somebody's already having some issues, that extra stress may have, tipped him over. So I think that it's a whole combination of things. But I think without objective evidence, without the testing that we just mentioned, without releasing the actual MRI images in the MRI report, I think everyone is just going to be out there making all kinds of guesses. But, I think that we're not really going to know the truth until it's just like you don't really know what's happening with your car until you take it in for a diagnostic, or you don't really know what your glucose level is and your blood level and your mercury level and your bilirubin level and your blood count is until you go in for actual testing. So, it's all like a mystery. The same thing even with the, in England with the royal family. They won't tell you what kind of cancer it is. But, for example, the princess who had the cancer, she had years of Crohn's disease. So 90% of those people, if it's going to be a cancer, it's usually a colon cancer, but they won't come out and say it. So it's always this mystery. I think the people who just come out and say, I have a problem, this is what I have, this is what I'm dealing with, I think it would make things a lot easier, and you wouldn't have all these rumors spreading.
Americans love using their credit cards, the most secure and hassle-free way to pay. But D.C. politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com.
We interrupt this program to bring you an important Wayfair message. Wayfair's got style tips for every home. This is Nicole Byer, helping you make those rooms flyer. Today's style tip: when it comes to making a statement, treat bold patterns like neutrals. Go wild! Like an untamed animal print area rug under a rustic farmhouse table from Wayfair.com. Ooh, fierce! This has been your Wayfair style tip to keep those interiors superior.
Wayfair, every style, every home.
Yeah, 100%. Well, boy, this was so interesting. Everybody, be sure to subscribe and share to this podcast. And Dr. Peter Michalos, this was really fascinating. I feel like we all learned so much, and you brought up so many really powerful points that I think shed light on what may or may not be happening to him, but also the history and all the issues that he's dealing with. This was just terrific. Thank you so much for being here.
Thank you, and thank you for allowing me to present the human side and the compassionate side, because, one day it could be us and we may be treated a certain way. So we want people just to get the best health care, to try to stay healthy and have a long health span, not just lifespan, and keep listening to WABC and to the great Cats and Cosby show to learn more about staying healthy, living long, and healthy.
Absolutely. We love having you on, by the way, Dr. Peter. It's always great to have you.
And thanks for always getting the truth out on your show and your podcast, and so many years of great journalism and getting the truth out.
And everybody, I'll be back soon with another great edition of Protecting America. And of course, you can catch me every weeknight, 10 p.m. to midnight on the legendary WABC Radio. This is Rita Cosby, and thanks for all you do to protect America.